Please go ahead, sir. We are live now.
Good evening, ladies and gentlemen. Can you hear me, Anshul?
Loud and clear, sir.
Thank you very much. Good evening, ladies and gentlemen, and thank you for joining us today. Uh, it's my utmost honor to welcome Dr. Anil Kumar, Deputy Director General of Health Services, Ministry of Health and Family Welfare, Government of India. I'm sure, sir, despite your heavy burdens, duties, and responsibilities, you have spared time to enlighten us today with your insights and views. And thank you very much and welcome. I'm also delighted to extend a warm welcome to our distinguished panelists who are renowned names and experts in their own respective fields and have joined us today with their respectives and perspectives gained over long and rich experiences. Let's take ourselves back a little bit, and as we know, 2020 began quite fine, and then suddenly we had this March 2020, and the whole world changed for us. Thereafter, of course, so many things happened. We went through this first wave of pandemic. Slowly and steadily, we started getting our perspectives back. Vaccines started getting developed. We got to know exactly how to so far take care of our own selves, and we started believing that the worst was behind us. Though historical perspectives quite said that pandemics have this unique nature of coming back to us again and again, but somehow we all thought that somehow the worst was behind us. However, in the last 2 months or so, what India has witnessed is unprecedented. We have seen massive increase in COVID cases. I mean, I'm talking about 10 days back. There was an unusual resurgence in, as we call, the different types, the variants, the mutants of the original virus. And we saw people running helter-skelter for oxygen. We saw beds not being available. And this was a story across the country. It was quite heart-wrenching to see many of us, our own, citizens of this country, and especially this time it was my own experience of 3 hospitals in the North region. We saw that the younger population, I mean, that was the one which was the most affected. A pandemic crisis of such magnitude and such, ferocity was not even experienced, and we never even thought that it will come in front of us. But anyway, it somehow disrupted our thinking along with people's movements. It disrupted the going back to work, that opening up process. And I think somewhere it also touched us psychologically, in addition to curtailing our movements, etc., etc. Many more plausible theories came forward that, we could have done this, we could have done that. But there's a small, example which I give to a lot of people when they ask that we could have done many more things. Let us say there was a household and who catered for 10 people drinking water in their house, and suddenly the housewife realized that summer is coming and let me now cater for 100 people. So you have more number of fridges brought, more bottles, more water capacity increased in the household. And suddenly one fine day you had 9,000 people standing or 10,000 people standing in out their house asking for water. I mean, can you ever prepare for such an event at all? And I'm sure the answer all of you will give is a big no. We could not have been prepared for such a magnitude of event that stuck on us. I think it also brought immense amount of responsibilities on the on the CEOs, on the different organizations of across sizes, across the industries, where the uncertainty of the new normal, it became much more precipitated by this sudden surge of pandemic. I think today what we're going to discuss is a very, very pertinent topic as we now see the cases going down once more. the positivity rate coming down once more. There is a positivity again in the environment, and we are again started thinking about once more going back to work. We started thinking about transitioning from the mandatory work from home, from to going back to work in batches, doing so many things. Maybe going and doing certain things which are out of the box, etc., etc. And I think every company has now started thinking about a different strategy of how we want to go back to work. If all of you recall, when we sort of went through the first wave and we got our feet our mind together, you know uh, testing, isolating and treating was a something which every one of us remembered, that we need to test more, we need to isolate, and we need to treat. I think along with that came the vaccines, and we started vaccinating in a big way. So there are so many things which are happening in the ecosystem which are sort of there to help us now maybe have a better understanding of what stands in front of us. I mean, it is a big question mark in all our minds whether we'll have a third wave, when will it come, whom will it affect more. But I think they're all conjectures, they're all guessworks. I mean, we will leave that to, I think the only God knows, I mean, what is going to happen here, and nobody can pinpoint exactly what's going to happen. But I think what we can do are, many things, and I think as today this very eminent panel here is here, and we have got a lot of knowledgeable people who are going to share a lot of thoughts. I think it's the right time, the right place to discuss it as we once more think of opening up. Is it early? Is it late? It is the right time, not the right time. I think we will have many more perspectives coming out today. And so I think the deliberation that are going to follow are going to bring in some many more novel solutions. And I think we'll be much more knowledgeable. Without talking much more now, I think I would now invite our chief guest, Dr. Anil Kumarji, to address the audience. So thank you very much.
Thank you very much. The office bearer of ASSOCHAM, the members, the dignitaries, the panelists, friends. This is my pleasure to address this more than 100 years old association, and it's very important association. Now, it has already been summarized what has happened during last almost 1.5 years. It has been very beautifully summarized. Now, in fact, so far, India has reported some 2,90,000 cases. More than 350,000 deaths have been reported. And even now we have the 12 lakh active cases. But now things are improving. Now we are at one point of time, 400,000, more than 400,000 cases were being reported on daily basis. And now it is 90,000, and it is coming down day by day. So things are improving. As already said, the positivity rate, which was more than 20% positivity of the test conducted, it was more than 20% at one point of time. Now it is less than 4%. So with this, we are we are starting our work everywhere. But this is a time when we need to be very careful. Now, I just want to share with you my experience from field. Now, we talk about the doctors, we talk about the nurses in the hospital. They are definitely working hard, and they are supporting. They are also losing life. But anytime we forget the contribution of many other people, like people working at the district level, the public health people, the nursing staff, or the multi-purpose worker working at the grassroots level, ASHA worker working at grassroots level, the community, the role of panchayat. Now, I know at panchayat level, and it is not normally covered by media what has happened at the level of panchayat. Now, panchayat people, they organized themselves. They were supporting at the panchayat level, and it was not covered by media, but I have seen that at panchayat level, they organized themselves. They were ensuring that a movement of people is restricted. At some places, I have seen that people, they are 24/7 They are on duty, the volunteers from the village, and organized by the panchayat, and also at village level. But I saw that if somebody is isolated at the hospital or somebody is under quarantine, their neighbor, they were supporting. Uh, the domesticated animals were being fed. The children were being supported, and there are so many other similarly. What I saw at the in the urban area, the RWS, they organized WhatsApp groups, and they were talking to each other. They were supporting the health authorities by sending messages to their members, and also guarding the main entry. So all that was happening. Even industries, factories, they organized themselves. So that was tremendous, and that is because of that only, we could control the pandemic in first wave also, and also in second wave. So this we need to, I think we need to continue this in future also. And this is very important because nowhere in the world, no country can have such a the type of resources which are required in such a pandemic to reach each and every house. So we learned a lot from this. We need to share what has happened everywhere, different factories, different industries, whatever they have done. They need to share this information so that others can also operationalize the type of activities they were conducting. Now coming back to the test, the laboratory test. Now, laboratory tests are very, very important in present scenario, and this is the topic of today's discussion. First of all, with the help of tests at the level of laboratory, or maybe now we have the self-tests available at home level. Now, these tests will not only help in detecting a case early and better management of case, but this will also help in reducing the transmissibility time of the infection to others, and that will help us controlling the occurrence of cases and controlling the pandemic. And also this laboratory test is a very important tool through which we can have a surveillance system set up. We need to understand the test being conducted and the results. Now and this analysis of tests, not only at the national level or state level, at the local level also. Now if you are having an industry, you are having so many people working with you, why don't you analyze, or you give this responsibility to somebody who can analyze the data, who can tell where from these positive cases are coming, how many tests are being conducted, what percentage of tests are positive, and somebody can interpret it. It's not difficult to interpret it, that type of data for the purpose of interventions. So that can be done, and you can find out the high risk group who all are getting positive. Are they from same locality, or they are from different locality, or they are from same department in the industries? So that type of analysis will help you to identify those high risk area, and then you can start the intervention, and you can take support of the government agency to control the occurrence of cases in that particular section, or that particular section of the society, so that the further spread of the occurrence of cases can be stopped. We have two types of tests. One is RT-PCR, as we know, which is a gold standard, and then this is we all other tests are compared with this gold standard test, and other is RAT test, or the rapid antigen test. So we have some 2,500 laboratories conducting RT-PCR, and RAT is available nowadays in most of the health facilities in the government, and also in private facilities. Now, why RAT has a some limitation, because the specificity of RAT is 100%, but sensitivity is not. It means the test is able to detect all those who are not having the disease, but test is not able to detect all those who are having the disease. So it means when somebody is negative for that, then we are not very sure whether the person is having disease or not. And then we have, if the person is symptomatic, then it is necessary for us to get the RT-PCR conduct in this case. So that we have to understand and we have to tell everybody, because once that is negative, then people are they go with the feeling that the test is negative, and then it is possible that if they are considering that they are negative, and then they may unknowingly spread the infection to others. So that is one thing which we have to tell everybody how to conduct this rat test. One is all the private facilities, or all the facilities available in different industries or the shopping complex, or other places. The facilities available, they should have this test, facility to conduct this test. The other is you can have some booth available in one shopping complex. You have booth, or some industrial area, you have some booth, and preferably these booths should be functioning 24/7, so that there is no delay in conducting the test, and you can actually detect cases very early. So that is one way. Or we can have some sort of drive-in testing facility, where people can just drive and get the test conducted. That will help reducing the transmission at the time of testing. And also and this is very important, because if so many people, they are coming to get themselves tested, then there's likely that overcrowding over there, and because they are all at high risk, they're more likely to spread the infection to others. So that we have to keep in mind, that there's no overcrowding at all, and test is conducting in this manner. And also we have to link all this rat testing facility has to be linked with the RT-PCR testing facility, because once the person is negative but he's symptomatic, he has to get himself tested for RT-PCR as early as possible, so that and we have to consider this particular person as suspect. He should be at home, not attending to work, not meeting people, and he has to continue to be at home and away from others until RT-PCR for this particular person is negative. So that is one thing. Other is the important thing is that the self-testing. Now self-testing, which can be conducted at home, so that has that also has some limitation, because this test is conducted by the person himself, to take his own sample. He may be very cautious when taking that sample, and because of this, if sample is not taken properly, then the test may be negative. Then other thing is, in this self-testing, the other problem is that he can contaminate the swab, and that also will have effect on the result. But this self-testing it cannot be used for mass testing. This has to be used at home only. The more important thing is that whenever test is conducted, the results should be shared with the ICMR through to the app which is available over there. Now, if and that will help in actually detecting those high risk areas, or the people who are having this the test positive, so that further control measures can be taken. So this is about self-testing, and this is about all those testing facility which can be provided by industries. And I'm sure we are talking about the third wave, and we are talking about so many other things. Now more and more people, they are being vaccinated already. We have some 24 crore vaccine doses given in India, and the number will continue to to go up. With this, and it's not necessary. If we work hard, it may not be necessary that we have the third wave, or even if we have third wave, it may be very low third wave. So I'm sure if we all work hard and with the support of all stakeholders and of course, the industries and the trade, services or trade organizations, they have very important role in supporting the government in controlling the outbreak. And I'm sure we will be able to number of the COVID cases will continue to go down in future, and we will never come back to what has happened during last 2 months. With this, thank you very much for inviting me. Thanks.
Thank you so much, sir. I think very clearly, I think we all are going through this. It seems like an eternal sine wave of pessimism followed by euphoria the moment some good news comes, then some kind of an optimism, then going again into pessimism. I think the whole circle, sorts of keeps on repeating. But I think one thing has become very clear, that the fight against COVID will rest on these 4 pillars of testing, COVID appropriate behavior, vaccination, and treatment. And I think the panel which is ahead of us, I think is going to clearly deliberate, leaving out the treatment part, which is, I think, totally clinical, into the whole paradigm of these 3 pillars. If you have to get back to work, what role does testing play, the COVID appropriate behavior, and of course their employees are getting vaccinated. And I think Mr. Abhimanyu Roy, who is the Executive Director, Avalon Consulting, who will lead the proceedings now. And with his experience, I'm sure he has his own perspective. And I think the discussion that will follow is going to be very, very enriching. And it will point us to the direction as we move towards opening up of our industries, opening up of companies, voices.
Thank you, Commander Bali, and thank you, Dr. Anil Kumar. I think the opening remarks made by the both of you were very, very interesting, very insightful, and like the both of you have mentioned, that the situation is dynamic, it is evolving. We've had a very rocky 15 months, but now we are all preparing to go back to normal, go back to work. And I think today's session in that sense is going to discuss how best we can do this in the light of the knowledge that we have and the information that we have today. So hello and welcome to all of you. It is my pleasure and my privilege to be hosting this session. We've had these intermittent lockdowns and opening ups over the last 15 months, and now we are all looking forward to, let's say, hopefully a stable and a durable return to work. Even though there is fear that there might be more outbreaks in the future, but despite all of that, as management people, as organizations, our attempt as industry would be to develop a system or a process by which we can make this return to work durable and mitigate all the risks around it. Of course, it's needless to say we do need to now return to work. The economy has taken a lot of brunt in the last year or so, and despite the hype, not the hype, but despite the fact that there are certain parts of the economy which can manage to work from home, chiefly all kind of digitally enabled roles or roles which can be done remotely. And that is a significant part of our economy, but it must be remembered that a large part of our economy is still manufacturing, and it is also, even within services, a large part of the services sector is about informal sector, it's about contract labor, it's about people on the street who need to be going to their site of work and who have to be physically present. So returning to work is an absolute reality. We have to get back to it. We cannot say that there are things like hybrid return to work and a few days in office and a few days at home. Those paradigms are probably relevant for only a certain part of the economy, and the bulk of the economy still needs to be going out and working. So, having said all of this, I think there are lots of uncertainties and question marks in people's mind, both on the employers and the employees, and therefore, one of the important levers that has been identified is testing. Like it was mentioned in the opening remarks, testing, isolating, and treatment is the model to follow. And how can testing really help us get back to work, return to work in a very stable manner is something that we would like to touch upon today. So we are privileged to have a very esteemed set of panelists. Each of these panelists are from different industries, from manufacturing, from services, from IT, and each of them will have their own perspective. So in our opening remarks, I would just request each of you to simply share what have you observed in the last 15 months or so through the first wave and the second wave and so on. As a member of your industry or as a member of your organization, what have you observed? What have been some of your insights or learnings on how your organization has worked through this? And therefore, today, what do you see are the key needs for industry to come back to work? So I would like to just open up the discussion with Mr. Siddiqui. If you're there, then maybe you could start.
Good afternoon, Mr. Roy, and thank you for this opportunity. I think compliments to ASSOCHAM for organizing this very critical and very relevant initiative at the right time. I think when we looked at the first wave and the new normal at that point of time, I think it was reasonably within our expectations and maybe a kind of wherewithal to handle it. But when we look at the second wave, the impact, the disaster, I think it has been very tough, very, very tough for industry, specifically for manufacturing sector. In our case, automobiles, where perhaps largely the physical presence, as you rightly commented, is part of the business operations, while there is a little possibility of hybrid model. When we look at returning to work, I think it has been a much more careful approach of graded opening, very gradual step-by-step building operations. But I think the top priority in the thinking of our top management board level, three perspectives we discussed. COVID pandemic was seen not as a business crisis, but as a human health and well-being safety crisis. And therefore, the top priority shifted from building operations to maybe taking care of our people, their families. So employee health and well-being was given the top priority over business issues. Second perspective is that we not only need to support our own company employees and their family, I think we'll have to stand in for the larger community, the government, as a responsible corporate. That was the thinking of the Maruti board very clearly. Last 15 months, that is what perhaps has been driving our strategy of handling this pandemic situation in the country. I think third perspective, when we look at this COVID pandemic 2020 last year, I think we did both taking care of our employees and their families, and we looked at supporting the government in the best possible way. I think one simple perspective here is 2020 pandemic, we looked at ventilator production as a company and tried to really create that kind of treatment infrastructure in the country. This time, we looked at oxygen generator plants and building up that kind of production capacity. Now, when we look at return to work, I think the first immediate perspective was to establish a senior management team of all business leaders driven by HR with a distributed leadership perspective, total empowerment, very speedy decision making, so that we can respond faster to this kind of situation. Maybe very strong SOPs, COVID appropriate behavior, very strong focus on testing, because avoiding the spread within the factory premises, 40,000 people, testing became very, very critical in that sense. And we used a combination of both RT-PCR and RAT with kind of plant camps handling that kind of testing so that we can get faster results and then be sure of who's going to work. Otherwise, quarantining people was perhaps the next alternative available to us. Perhaps when we are looking at this entire perspective, workplace management very quickly adapt and adopt has been the basic approach. To a great extent, when we look at this hybrid model, wherever possible in the managerial cadres, office functions, staff functions, we went with work from home so that less people come and get exposed. Factories, maybe social distancing can become a big factor. In the second wave, especially when we looked at ventilation perspective, special air purifiers and double masking over and above what was done in the first wave of pandemic. These were three specific things supported with very aggressive testing so that we ensure the safety of our people who are going to come and physically work. When I look at graded opening, one plant, one line, single shift, so that one-third manpower comes in to start work rather than going whole hog and trying to produce 7,000 cars a day. That was a considered business strategy that perhaps for the safety of our people, one plant, one line, one single shift operation, slowly we will build up and then we'll see how it goes. Maybe redesign, restructuring of offices, even shop floors with partitions, canteens, 50% running of buses with empty seats. All these countermeasures, perhaps to a great extent, helped us. One basic change which was brought in that no physical meetings, either at the shop floor or in the offices, were allowed. Everything to be digital, and that kind of infrastructure was created. Maybe perhaps when we are looking at the basic approach, it was challenging the status quo of finding a way. And perhaps when we are looking at adapt and adopt, it requires flexibility. Flexibility in the mindset, flexibility in the working systems and processes. For a company of this kind of size and operations like Maruti, almost dealing with maybe 150,000, 60,000 cars per month in terms of production volumes and sales volumes, I think that kind of flexibility became the norm for looking at COVID appropriate behavior and all related countermeasures. But yes, I think somewhere what we realize is creating a positive assurance in the workforce was the biggest click for our people to be committed, to be confident coming back to work. And that required a kind of strong support on the medical infrastructure created for dealing with these kinds of people who are affected with COVID in a big way. So I think initial thoughts, Mr. Abhimanyu, I would like to keep it here. We'll be open to your questions, any other perspective. Thank you very much.
Sure. Thank you, Mr. Siddiqui. A very comprehensive view of how Maruti has really opened up. And I guess Maruti has the advantage of being a manufacturing company. It has probably worked through most of the last year, some part of last year, and is now also working. And therefore, maybe ahead of the curve in terms of having learned and revamped and improved processes and practices. And I mean, just the thought I have is that maybe there is some scope to share learnings as being one of the pioneers, maybe on this whole return to work phenomenon. So with that, if we could bring in Vijay from Mahindra and Mahindra, if share his thoughts.
Good evening, everybody, and thank you, ASSOCHAM, for calling me on this. And speaking after Siddiqui Saab is always difficult because we go a long way, and that's the reason I said speaking after him becomes difficult. So I'll not get into the basics of what we basically did to during the pandemic last year and this year. But we will also, I'll just talk upon what are the learnings and where we changed, what all we changed to ensure that we were there. Basically, I'll talk about we were. If you look at manufacturing industry like us, it is not about only our company we were talking about. Like Siddiqui Sir was talking about, it's the whole value chain that we need to look at. We need to look at our vendors, we need to look at our dealers, we need to look at the entire manpower, hence the vehicles created. It's a huge amount of people that we have to look at in case the pandemic. There cannot be a single stop solution that can come up, and each has got their own related problems that we come up with. But all said and done, we were able to do a decent job in the last pandemic. And this year, yes, the focus is completely different because at that point we were talking about testing, treating, and isolating. So that was the point that we did. And the second day was really surprising. Nobody knew what was happening. Till that time, we got our bearings together and started working on certain areas. Then we started doing some ventilators part, testing part, treating part. The whole thing started working. All said, the whole last 2 months, the last 2 years, we have learned a lot about things of the different ways of manufacture that we could do the traditional part, living aside the traditional of new way. Digitization has been the key area that we talked about. It is about meetings. The whole meeting of standing meeting on the shop floor, the whole concept that we were talking about is gone. Today we're talking about virtual meetings. It's all about leadership that we talked about. To get over the pandemic, we had self-paid small teams working in each of the areas, and they were completely empowered to take this. It was not about the rank. It was about the expertise that person held at that point. And hence, he was a leader of the team and he could completely manage the team. We need to come out with change to from front lines to silos and networks and teamwork. We completely stop relying on traditional organization structures that we are talking about. I would also look at areas where we're talking about flexible workplaces. We spoke about how do you create flexible workplaces. Reduce the number of people, have flexible workforces. Earlier, we used to have specific design lines for each of the products, come out with specific purposes or try to adjust each other and see the number of people, minimum number of people or have safe distance working that we talked about. If we can have safe distance working, safe working environment, because we do have safety in place. We never had a pandemic safety in place. So that was another learning that we had. What is a pandemic safety? It's very difficult for anybody to think that we can go and mask and work for 8 hours in the shop. Very difficult. So how do we ensure that safety is there, plus the mask is there, and you also have a facial in place, and you don't have an air condition there. So it was real difficult for us to maintain, but ensured that we could maintain those deficits. It is not about making profits; it's about keep taking care of people at that point. Remote workforce. We are still working remotely today. At least about 6,000 of our workforce staff workforce is working remotely. Never thought of in my entire 37 years of my career that the engineering industry would work for home. Today we're talking about 2 days working and 3 days working, or either a full day shift, week working from home for the next phase that we're talking about. Thanks to the pandemic, that the alteration, the thinking has happened that we can also work from home. Not as the IT industry would have thought that it would have done it earlier, the engineering industry could also follow. We had very clear association with the community. We worked around the community of all the plants, along with our team, to only ensure that it was all about confidence boosting. The confidence boosting that you are safe coming inside the plant, because we have also worked outside the plant. So that was one aim that we went, and we have a mantra called ESOP. ESOPs is not employees, it's employee social affairs. And we ensured people participate in the ESOPs, handing out everything, patients to community services, to managing COVID centers, to everything we have. So we managed the confidence of people, made those people to become ambassadors, to talk to people inside. So the community speak was very clear. The message was sent to each and every person that you don't have a problem here. We can be very clear. And we had about 4,000 people working now also coming on the shop floor. Way forward, we do not know where it is going to end. We are ready for any commercial disruption that are going to happen. We are making our workplace very much clear. Office spaces are now, the air quality is being monitored on a daily basis now. This was not the case earlier. It used to be a safety regulation we need to maintain, but it's on a daily basis. The filters are put on an SOP check every quarter. 3 days we have a SOP check for all the filters. We are looking at how do you, our own economic viability work without work, and look at how we can get buses 50% and all that. Testing is going to be one area. 95% of my employees have been vaccinated completely. First dose of vaccination lower, but 5% people. So we think that the severity of the COVID, in case it happened for the third phase, might be lesser in our case, but we have a huge community, the family, the small children, everybody at home, who can be one area of concern that is looking. We are only looking at these areas. I think I've taken more time, and Abhimanyu has been shaking his head, trying to get me to stop. Thank you very much. And I will wait for the questions. Thank you very much.
Thank you, Vijay. No, I was shaking my head in agreement to all the points you were making. So yeah, no, I think this was very, very useful, very insightful talk on all the changes implemented in your organization. And I think, like you rightly said, that in the third wave, you've made some other changes around air ventilation and air quality, etc., which have become more important. And the fact that 95% of your workforce is vaccinated is, of course, very commendable. And probably that means that you're well on your way to a much more smoother operations. So I'll come back to some of the points that you had made, but in the meanwhile, we'll just move to the next speaker, which would be Sangeeta from NASSCOM. If you could come on next.
Thank you so much, and good evening, everybody. It's a pleasure to join this session. I think if I start on a lighter note, the topic of the session says return to work. And every time I mention that in office, I'm scolded saying it's not as if you've not been working these 14, 15 months. So it should be about return to workplace. So just a technical correction around that. But I think everybody's saying hindsight is 2020. And if you look back at, the last 14, 15 months and what the IT industry has gone to, we've been much more privileged than many other sectors. As I heard the manufacturing industry stories, the informal economy stories, we've been very, very privileged that we can much more work from home, and our business is disrupted minimally compared to other sectors. But I think still nothing prepared us for when we think back on the first lockdown. We had very extensive business continuity plans, but a business continuity plan means you shut down your Chennai center and move work to your Pune center. There is nothing like everything in the country is shut. So it was a humongous effort to move 4 million plus employees to their homes. Everybody did not have a laptop, so we were shifting desktops in middle of a lockdown to employee homes as an industry, working with government to get a lot of approvals, which I think were very, very forthcoming. But I think the good part is in a matter of 2-3 weeks, the industry was up and running with 90-95% of employees working from home. And I think that continued very well. Productivity levels were up. In the fiscal year 2021, we were still able to grow 2-3% for a year we thought would be a bad declining year. And I think demand for digital technology is at an all-time high, which is very good for the technology industry in India. I think as the second wave hit, and I totally resonate with the thoughts raised by Mr. Siddiqui, it was no more about business. It was really about employees. How do we make sure we can provide the right support for our employees? How do we, the pain was very visible. A lot of our employees, their families were suffering. And I think most companies in our industry, as well as we as an association, all came together to do multiple things. One is obviously set up COVID help desks in our offices, providing access to hospital, healthcare, medicine infrastructure, arranging doctors on call where possible, ambulances, oxygen concentrators. I think there was so much work, and I think the important one was also everybody was on WhatsApp all the time, and you didn't know what was right and what was wrong. So really curating, validating information on contacts, resources. There was a lot of that going on. And I think, the kind of feedback we've got from our employees, just to, resonate with the support and the, the support the industry, I think that has meant a lot to this industry, which is all about talent and people. So we always said that, we were about agility and resilience, but I think the second wave has taught us another word, which is empathy. So it is really something that we are, taking forward as we move forward. As we look ahead, I think, return to workplace for us will be very great, because the virus is very, very unpredictable. There is just not enough information to plans on saying by September I'll have 15% of my workforce, by October I'll do X, Y, Z. Yes, we have those plans in place, but I think there are plans behind plans, because you don't know what lies ahead. But I think the 3 things that have been articulated are the most critical, right? Testing, vaccination, and COVID appropriate behaviors. So, there is always, even in a hybrid work model, there will be people who need to be at the workplace. The whole the culture of the organization, the collaboration opportunities, the ability to innovate. It does require employees to come back to the workplace, may not be 100% or all days of the week, like you said. It will be different models for different types of companies and the kind of work they do. But as they do that, testing is going to be very, very critical. And even in the second wave, in the lockdowns of the first wave, some states had mandated testing, and it was very hard to get access for testing for employees who had to be essential workers and be in office. So I think building out a very easy and affordable testing infrastructure is very, very critical. Vaccination, again, is a top priority for the industry. A lot of companies have rolled out vaccination camps for themselves, for the employees, dependents, support staff, the community. I think our aspiration is that by July end, at least a majority of the employees in this industry should have got the first dose, given our average age is 28. So we have very few people in the 45 plus bracket. So a lot of the effort is being done by the industry. And I think third is really re-architecting a workplace to make it, for COVID appropriate behaviors. I think, we have to learn to live with this uncertainty and make hopefully the best out of it, as we have, thankfully as a technology industry, been able to do till now.
Thanks, Sangeeta, for that overall view on how the IT industry has coped up. And we all know that the IT industry has really stepped up. It's like you said, agility and resilience have been its hallmarks this year. And I believe the overall industry growth and revenue, etc., have not been significantly impacted. It's done quite well. So all that is, of course, thanks to systems and technologies that are already in there. So I'll just now move to Dr. Ravi Gaur. If you could come in as someone from the lab side and from the technology side, it would be interesting to hear your views on this.
Good evening, everybody. And I'm Dr. Gaur. I think I'm from the diagnostic industry. And probably mine was one of the first private lab to start RT-PCR testing in India, because that's what time probably way back in March 2020, when nobody really know what is happening, what to do. So I think, when you talk about the topic, I think a very relevant topic today, because ASSOCHAM has picked up now a return to work. And I think this was a lot discussed way back somewhere in September, October also, like return to work. And there were a lot of, I think, thought process gone behind it, and a lot of companies got agreed to what to do, what not to do. But I think somewhere we were complacent, and we didn't actually take that, to the right, the appropriate behavior probably in our day-to-day handling. And that's why one of the reasons for the second wave was this. But let me confine myself to the diagnostic industry, or maybe the healthcare industry to a little extent. When it comes to return to work, I think we were always at work, probably. There was really, all throughout, we had to reorganize, and that is the biggest problem, because we have to continue work. And our responsibility was how to provide the testing facility and, to make sure that everybody is, timely detection of the COVID, the virus. This is for the first time, probably, you must have seen the diagnostics came in the forefront. Generally, it was like, the patient go have some symptom, they go to clinician, they advise a test. Here, it was not like this. And the labs were really not prepared for that, because generally in India, systems are used to, like, you have a referral from a doctor and doctor prescribes a test and this comes to you. So it was like we were flooded with the queries and what to do. On the other side, my staff was worried, because they were too much worried what to do, what not to do. Because not only because they were exposed to, like, they have to collect the sample. And now, not only their families, because they were not allowed, families were not allowed to come them out. Because if they say, if you go to a hospital or diagnostic center, you will bring back the virus home. So I think that was the biggest challenge we had in the first way when we came out from diagnostic. And all our centers were basically collection centers, the labs or centers were almost shut down, because nobody was walking to our center. So we have to really behave what to do, how do you handle the situation and keep doing the testing. So diagnostic came in the forefront. I think today we have almost 3,000 plus labs. So out of the 60% are private, 70% private labs doing all the RT-PCR testing, which is one of the, I think, best job. I think nowhere in the world has happened. All the labs are of high quality. RT-PCR is a high technology. It cannot be done by the normal the platforms. The skill to be developed, accreditations, which is approvals from ICMR and NABL, I think all of them, I think, put together did a fantastic job. And today, I think India that way probably. And we were, I think, still like in the country, we have seen the first wave or even the second wave, which came somewhere December onwards in the globally. That results were coming in 10 days, 7 days, but we were able to give reports almost in 24 to 48 hours. And today we have the people getting reports in 8 to 10 hours. I think that's where diagnostic industry make use and come up with the multiple things. The one I like to see the patient appropriate behavior, something which actually we noticed in the first wave. In the first wave, there was a basically totally uncertainty. Nobody knew what's happening. Nobody really, everybody was curious to know what's happening, what is next, what is next. There was a period of uncertainty, and there was a lot of questions coming up, and nobody really knew. Every day we had challenges, and there was center had some ruling, state was giving some ruling, and district were giving some ruling. And by the time in the morning we used to have some ruling, by evening you come back, but next day the rules have changed. So that uncertainty, and there was the directions which was not really the district guys were following their own rule, and that is a confusion which created. So it's same in the patient's mind. They don't know what to do, which test to be done. Somebody started RT-PCR, later on rapid antigen came, later on antibody came. The first wave was all this utter wave of confusion in everybody's mind. I think that is more important. After that, of course, in 3 to 4 months, things started falling in place, testing picked up, and I think some systems were in place. But when it came to the after that came we were given up hope that time. Then hope came along. Like, oh, now the vaccine is here, testing facilities are here. Now we have a home collection. The hospitals are ready for the admission. Testing can be done at by screening methodology, rapid antigen, and some rapid RT-PCR report. Rapid tests were into place. The surveillance plan can almost antibody testing was in place, reagents were in place, and I think things were falling into place. So from the confusion, I think which was a hope came back, and especially vaccine added to bigger hope. Now, this is, I think, that was a good phase. And then parallelly, things went down. So the non-COVID, because that was the biggest sufferer from our diagnostic. Because a lot of people who are chronic disease, they were not getting testing, they were not getting the right treatment. So they started coming out somewhere in December, January. So that's the time when the industry was getting back diagnostic. We found that, and although people are still not willing to come down to our centers and for blood samples, so all this, the customer care, technology, non-touch payments, online appointments, online booking, home collection, delivery of reports, everything, teleconsultation, all came up very, very fast. I think which was supposed to be there in the next 5 years or at least 10 years from now, that is already in place now in India. That is one thing. But second wave when it came was totally unexpected because I think we were expecting it's not like that, but the quantum, the surge which came, as Commander Bali mentioned out, it was like something which is, it was there was no confusion this time. I think we knew this is going to happen. This is what the steps journey of COVID will be. But so this was more of knowing that there was a lot of anxiety, a lot of desperation, and there were a lot of breakdown because there's an infrastructure resource crunch take place. Now, everybody wanted to get a test done, test done, test done. And at one point of time, we were not all diagnostic industry. The home collection was not possible. We had to wait for 3 to 5 days. And many a time, we have to shut down the collection. Now, that is which second wave will hit us. But of course, I think things have now fallen into place and things are getting better. So we have learned, I only sincerely hope that the third wave, I think we don't give up on learning what we have learned in the first from the second wave, because I think in second wave somewhere we have defaulted definitely in our social behavior, the way we handle our offices, way we handle our staff, way we handle because in second wave there was no demarcation because in the first wave, okay, I had an exposure with somebody, I get my 5 days testing. Now it was like 50% people were coming almost positive. So everybody was coming positive. How do you know who's exposed, who's not exposed? That was the biggest challenge in the second wave. So, and then there was a shortage. So people were getting tests done today, tomorrow, day after, running around for the medication, the diagnostic CT scan, whatever laid in their hand, they started doing that. And that is what I think shattered the entire. But I think the things have fallen in place. I think all of us, the government and the private provider, pulled come out of it very well. And I am very, especially the corporates, organization, they played a wonderful role and they supported us. And they really had their own policies in place. And the HR probably played a very important role because being a healthcare provider, we can't be sitting at home. Because HR has to be the leading guys, have to motivate the people. And so we took staff insurances, get them vaccinated. The family was taken into confidence. Now we're talking about vaccinating the families. And all safety measures, slowly and slowly, we're opening up and back again. But that's the biggest learning, and from confusion to anxiety. And I think future is a hope. I'm very hopeful that things will fall into place and be much better ahead. That's it. Thank you very much.
Thank you, Dr. Ravi Gaur. That was a very that was a very comprehensive view of actually the whole evolution of this pandemic and how chaotic things were in the beginning and how testing has actually evolved in the past 1 year. I think we remember that earlier the testing was very, very sporadic. It was less. There weren't enough volumes. Now the volumes have increased and it's much more reliable. I mean, there will be, of course, some questions around how rapid antigen test can really respond to the current crisis. And so I'll come back to that. Meanwhile, I'd just like to ask Anubhav from Boeing India to give his opening remarks.
Sure. Thanks, Abhinav. Just want to check if I'm audible.
Yes, you are.
Sure. So thanks. First, I want to congratulate ASSOCHAM on organizing this timely event, and this is really a right time to have this discussion. From a Boeing perspective, I would want to give maybe two sections of or two parts of thought. When the pandemic hit, as an organization, the approach that we took was really because the pandemic follows, or when we say follows, it is we wanted to react to the pandemic and prepare first to make our industry resilient, right? So we took what we are calling as a confident travel approach for our industry, and we took that approach which is more of a data driven approach for decision making, and we created this confident travel initiative which then ran over months, and it still continues to run and feeds us, which primarily focused on how can you really prevent the virus. And I'm just talking just from an industry perspective. The first was how can you prevent the virus from boarding the airplane, how can you keep the airplane virus free, and then how can you maintain a healthy cabin environment. That was the broad theme. And as I mentioned, we really did focus a lot on a data driven modeling and decision making. We partnered with a lot of leading institutes. We have Boeing Medical, we partnered with a lot of medical agencies, and we did an extensive amount of research and analysis. What came out of that was, and I'm just, we can't share everything over here in a short span of time, but just giving you some guidelines. There were specific guidelines that we came out as far as disinfection of aircrafts and laboratories was concerned. Now, while aircrafts and laboratories maintain within an aircraft highest level of standards, there are certain measures which are replicable across industries. So we did co-develop a UV wand at 222 nanometer that can help disinfect airplanes, but it can also be applied across other industries like hospitals, schools, or other high volume areas. We are currently working on futuristic technology of antimicrobial coatings that can prevent virus from transmission. The other area there where we did a lot of data-backed approach was, and it got discussed briefly, that what is the kind of MERV rating, which is the minimum efficiency rating value, across various ecosystems that you would want to maintain, so that of air circulation across office, across aircraft, across airport can be maintained at an optimum level. We also did what we are calling as computational fluid dynamics simulations, where we actually ran simulations within an aircraft and within a conference room to understand what is the behavior of a virus. So there were virus taken and there were detailed analysis done to understand and the latest report that we came out was what is the testing efficacy. So we published a report with how it really improves versus the quarantine rules, and how does RT-PCR versus a rapid antigen test taken at a regular interval really helps remove, optimize some of those quarantine rules across countries. So that's what we did at an industry level, because we really wanted to focus on getting the industry back on track. as far as our employees was concerned, the approach has been primarily, we were planning like a lot of other organizations really return to work. But obviously, given the second wave, we couldn't do that. But what I think is again a multi-layered safety layer, which is first approach that we have taken is segmentation of our employees, really segmenting which employees are required in office, which employees can work and who employees and understanding who are the employees who are going to be in office, and obviously facilitate that with COVID appropriate behaviors in office management system. The second step or the second multi-layer approach is obviously ensuring vaccination to reduce the impact, and again that is backed by a lot of research where we are doing with where we are involved with a lot of US universities to understand what is the efficacy of vaccinated people against the transmission of virus. On self-testing, we have really not mandated that, but the point of view is about how we can really do a mass scale or evaluate how does it really help in terms of optimizing or reducing the infection that you are really going to the office. The last part of what I want to do from an initial thought, when the second wave hit us, we were also like all of the organizations really focused on employees, and Boeing did commit Boeing did commit a 10 million aid as part of the overall initiative. The good part about that 10 million aid, which I just wanted to highlight, was it was not an aid that was given just in terms of monetary aid. We actually went up in setting up field hospitals across Uttar Pradesh, Tamil Nadu, Chhattisgarh, and few other states to actually set up 100 to 200 bed field hospitals. I'm happy to.
Hello.
I just want to share with the August audience here. Over to you.
Thank you, Anubhav. Again, a very useful, very comprehensive view of all the steps that Boeing has taken, both on the product side, your on the aircraft side, as well as within the organization. Some very interesting points there. Now, I would request Urvashi from Genpact to give her thoughts, please.
Thank you, Abhimanyu, and thank you, ASSOCHAM, for inviting me to this very, very relevant discussion. Look, at Genpact, and I think actually for all the participants here, it's adequately clear that the future of work is going to be very different. We are never going to get back to a 100% physical office model, and it's going to be, I think, a combination of onshore, offshore, work from home, work from office sort of a format that I think we all will ultimately gravitate towards. So it will be a hybrid workplace of the future. I think all that is absolutely clear by now. And all of us, I think, are in the process of gearing ourselves up for that reality. And the last 15 months or so have given us a taste of what all that could entail. Luckily for us as an organization, we had already invested quite significantly in collaboration tools and cloud-based tools, which helped us move to work from home, like Sangeeta pointed out, in the IT industry very, very speedily. And it's been working pretty smoothly up till now. Having said that, we all recognize the need at some point in time, whether for client needs or for basic socialization purposes, that some bit of our population will come back to office. Currently, we are less than 5% of our employees working from office. So it's been a very, very deliberate and thought through method of bringing people back. We are not rushing into it, and we will wait and watch how things unfold before we really ask our people to come back. Now, really central to our entire COVID approach have been two themes. One, it has been first and foremost health and safety of our employees. And the second has been us also being part of essential services that we provide to a lot of our clients in the banking sector, in the pharma sector, healthcare sector all over the world. And a lot of these sectors are involved in fighting the COVID crisis. It is really continuity of us providing services to our client and ensuring that we do that well. So it's really health and safety of our employees and client satisfaction and continuity, which are the two key pillars on which our overall approach is driven. While we've done whatever we could to manage the last COVID crisis, right from providing help desk to employees, oxygen, hospital beds, which a lot of us have spoken about. So I'm not going to repeat that. We have gone over and beyond on whatever we could do to provide help and support, not just to our employees, but also to communities around us. But fundamentally, we believe that COVID is actually an information crisis. It's an information problem. And why do I say that? So let's look at some of the statistics. Today, 1 in every 1,000 asymptomatic people is positive, and you never know who that person is. As per Boston Consulting Group research, 60% of the transmission that happens of COVID today is through asymptomatic people. So it's very, very important as we think about our return to office strategy. How do we tackle this information problem? And really at the fundamental of this information problem is how do you make that information available, which basically can be done only through testing. So we have actually become an operating partner with a consortium called the Rapid Action Consortium, which is working with association called the Creative Destruction Lab, which is based out of Canada, where we are working together with this group to provide scalable solutions to organizations and society at large for testing, which can be done at scale and which can be used to tackle this information problem. So, for example, we are applying our expertise in analytics and process design to see how do we arrive at standard screening protocols, how do we look at testing, and how can we really scale that up. We've already implemented that in the US, and we are now next looking at it, implementing that in India. So we are working with exploring that with ASSOCHAM as well. So once we sort out, this information problem, for that, the other thing we need to do is really increase testing. Now, the good news for us is that we started testing, or we started doing weekly testing for our population that was going to office several months ago. And we kept it voluntary. We have almost 60-70% of the people who were anyway getting tested voluntarily every week while they were returning to office. As the second wave hit us, we've actually made weekly testing mandatory for all our employees that are going back to office. So we are doing the rapid antigen testing in India. In our other geographies, like in the US, we are doing, it's the nasal swab that we do. So it's different sorts of testing that are happening across the world, but testing has pretty much been made mandatory for us, and we will continue on that trajectory. I think that's going to be very important. And as we think about larger populations coming back to work, I think the strategy has to be a combination of vaccination as well as testing. That combination that has to be deployed. So how do we get our employees speedily vaccinated? How do we get them tested? And what are the safety protocols that we deploy in organizations? And I think a lot of my colleagues spoke about that as well. And we are thinking about the same stuff, social distancing, air quality, masking, office layouts, and a combination of those three are, I think, required for an approach or a more robust approach to managing testing. And again, like data shows us that almost 60-70% of transmission can be reduced by the right combination of testing and vaccination.
Thanks.
Those are the initial thoughts.
Yeah. Thanks, Urvashi. I think you really brought out the problem as an information problem, and despite all the other things that organizations can do, testing, how important testing is to really ensure a stable return to work. So this is actually a very good point to for Vinay to come in from Abbott, he being from the test manufacturer side. And Vinay, you heard all the participants. Some of them have had very a long experience over the last 15 months. They have actually transitioned a large part of their workforce back to work across factories and offices. In IT, they haven't yet done it, so they've been more at home and it's been more hybrid. Genpact has had its own experiences, including a lot of focus on testing. So how do you see this? What kind of solutions are there possible? And after we've heard you, maybe the other participants will have some thoughts on what they hear from you and how they can adapt it to their environment. Over to you, Vinay.
Thank you very much, Abhimanyu. First of all, thanks to ASSOCHAM for this timely webinar. And I'm really heartened by what I heard by other panelists. And I pick out 2 or 3 key elements here. Number one is around, this is not only a business crisis, this is a humanitarian issue, and making sure employees' health and well-being is taken care of is paramount. Second, what I also heard was companies have taken actions to go above and beyond just the workplace and gone and provided support to the staff and their families and broader society. And the last thing which I heard from Ms. Singh was data-driven decision-making has become very, very critical. So making sure that we take these decisions in a way that allow us to maintain the business resilience is very, very critical. Anshul, can you help me get, be possible to share my content? Thank you. So I'd like to share the advantage of going last is I can talk about some solutions to the needs that have been raised in today's conversation. So first of all, we have stopped calling it return to work. Most of the companies have been at work all along. It's about ensuring business resilience and looking forward to expansion. That's the approach that we are taking to testing now. So when we look at the needs in the market, and I hear all of you, there are 3 key needs that have come in, right? How to provide a safe environment in the workplace. So in-person operations, whether it is in services sector, definitely manufacturing, logistics, plantations, many of these categories, it's a must. But even in other places where a lot of time people are working from home, the need for that physical close interaction in creative situations, in brainstorming is obviously there. Second is how to provide support to employees and their families when at times the public testing infrastructure could be under stress, very important. And third, like Dr. Gaur said, oftentimes the rules, the guidelines keep changing. How do we make sure that we keep abreast of those? So we have developed some solutions which address these exact needs. And our solutions comprise 2 key elements. One is our rapid tests, and I'll talk in a minute about those. But very importantly, we have tied up with a whole network of service providers who can actually implement these solutions on-site at the companies. And this becomes very, very important because you don't want to have to resort to public testing infrastructure at all times, but make sure that the productivity is maintained by offering this solution at the workplace itself, so people don't have to go out, get tested, and so on and so forth. And these are backed by best practices sharing. We have launched these solutions in 15 countries across Asia Pacific, and we are finding they're learnings from different countries and different in categories which are highly transportable in other situations. Any kind of training. And very importantly, the biohazard material handling. It becomes a key part of how to handle these solutions. So our tests comprise 2 key ones. One is our molecular platform, which is like RT-PCR is also a molecular platform. But the advantage is that the results are within 13 minutes. In fact, if it's a positive case, the result is in 5 minutes. And that is very important because it is the positive cases that you want to isolate quickly to make sure that they don't, spread disease amongst others. And second is the antigen test, high quality, above 98% sensitivity, results available in 15 to 20 minutes. Again, the whole idea is use screening using antigen test, and then in case a positive case is found, if a confirmatory case is required, we can do it using a molecular ID now test. So a one-stop solution of sorts. The other piece of it is around tying up with a bunch of service providers who can do this on site. So places like Batti, where there are lots of factories making sure that the right medical staff is available to carry out on-site testing on a weekly basis to ensure safety in the factories. A lot of places where the factories and these plantations are, making sure that this solution is available there itself. Where the volumes are high, we set it up on a permanent facility where like 1/5 of the population gets tested every day. So every week, everyone is tested, making a safe environment. Volumes are less, come there, set up a camp one day a week or 2 days a week, and make sure the staff is tested. And of course, in current situation, providing a home testing solution so that the test can be performed at home itself and result provided there itself. So in summary, this solution is already available across markets, one-stop solution. We're able to start this within 7 days. High quality test, meaning that you get very few false positives and very importantly false negatives. Results are available within 15-20 minutes and an ICMR report within a day, more often than not within 8 to 10 hours. On-site operations to make sure that the employees are safe and to minimize any kind of productivity loss by sending them outside. And regular testing basically helps maintain the resilience of mission critical operations. So I wanted to talk about solutions from 2 points of view. One is the availability of these solutions, but more importantly, the kind of impact it has on the psyche of employees. In most cases, what we have found that when this kind of a testing solution is provided to employees on a voluntary basis, initial signups are 70-80%. But very soon, the numbers actually start going up. There are factories now where we are testing where the uptake rate is upwards of 95%. And these are still, without having to mandatorily require them to be tested. So, and when we've gone back and talked to those employees, the first feedback is, hey, I am really happy to do that because it is ensuring that I'm working in a trusted environment in the workplace. So that peace of mind is very, very critical, because more often than not, a lot of these employees have elderly parents or relatives staying with them, making sure that you don't carry any kind of workplace infection back home. It's very, very important. So I'll stop there. I just wanted to share the availability of the solutions. I'm happy to say, without taking names, some of the panelists on here, their companies are already using these solutions both in India and overseas. And so I'll turn you back to you, and happy to answer any questions subsequently.
Yeah, thank you, Vinay, for this very interesting presentation on the solution that you have, and the fact that it's a product and its service both are integrated very well. So at this point, now that we've seen this type of testing solution, I think it's a good point for me to just probably go around the table, ask each one of you, having seen some of this or heard from Vinay on possible solutions, was testing a very important part of your return to work strategy? If not, were there other constraints that you were facing in implementing testing? And do you feel now that going forward there might be more providers and that will give you the confidence to make this kind of rapid testing or decentralized testing at site with quick response and quick results? Would that be a linchpin of your strategy going forward? And if you have any questions for Vinay on the the specifics of it, you're free to ask that also. But my interest would be to understand how excited or how enthused you are about this very concept. And secondly, I have another point, and I'm combining both these in the interest of time. You could address both if you have the time. Um, that would be on. Do you have any other sort of requests, or do you have any other suggestions on how industry could collaborate on this whole return to work strategy? Because we've heard a lot of interesting ideas across manufacturing and services, but do you think that there are ways of getting together and sharing best practices or something like that? That would be a second point, which if you could address. So I would like to start again in the same order with Mr. Siddiqui, if you could share your thoughts, please.
I think Vinay has shared a perspective which I think is going to show the way for future. And that is where perhaps at Maruti also we are trying to really use it to the best possible extent. That not only handling second wave, but also proactively preparing for the third wave, that how best we can handle all our, Maruti employees, very big number, but also suppliers and dealerships. So even a bigger number for us to survive in terms of our operations. But at the same time, I think perhaps to a great extent at our top management level, one thinking is very clear is that vaccination at this point of time is the best way forward. And to great extent, I think in this entire crisis 2020 and even now, I think it has given an opportunity to employers to make that leadership intent, that statement that you care for your people. Otherwise, in conferences and slogan shouting, we are very much ahead on this. People are the best assets and blah, blah, blah. But actual practice, I have rarely seen in my 40 years, Maruti is one such company very consistent in this kind of leadership ethos, because earlier a public sector company, now a private sector company. I think to a great extent, this kind of crisis has given three major outcomes to us. One is that perhaps you have this opportunity to make your leadership intent and really create that kind of impact on 40,000 people direct and maybe 100,000 people, 150,000 people indirect, that they are going to create your business opportunities and business performance in the times to come. That is the kind of positive assurance, the kind of commitment, the kind of loyalty Maruti talks about, work culture. Second perspective, kind of digital acceleration which happened because of this pandemic. Even automobile company or manufacturing company, as Vijay said, realized the potential can be there for us also, not only for technology companies and digital companies. And I think in that space, when we heard Dr. Ravi and also now Vinay, I think to a great extent, moving forward with more data-based analyst approach and maybe looking at digital tools can be perhaps a good way forward. And somewhere you will be finding now, instead of vaccination, there can be a nasal spray which will come in for this purpose, which will be just a 2-minute affair and you are totally vaccinated. So maybe Zydus Cadila and some such companies are working on this. Third is that perhaps when we look at some of these proactive measures, in Gujarat for our Suzuki Motors operation, we have established a new hospital. Luckily, it got launched on 16th April this year. And that is where the second wave we faced. And this hospital became a big, big, big savior there. I think we have to look at some such long-term, employee-oriented measures and creating this infrastructure to support the government initiative. I think that's my precise perspective, Abhimanyu-san. Thank you very much.
Thank you, Mr. Siddiqui. Vijay, would you also like to share your thoughts on what you've heard and your response on the same?
So I echo whatever Siddiqui have said in the first phase, and second, I just wanted to add is that this entire pandemic has created a sense of humility in the entire world, at least in the entire the group that we work in. It is not about, I said, just like I said, it's not about the factories, it is about the dealerships, it's about the small entrepreneurs who work with us as the vendors, everybody. And learning has been huge. It has not yet completed. We do not know what surprises are going to come up. As I said, the second phase was a surprise to us. Whatever we did in the first phase was to be undone in the second phase, to redo in the second phase. So I do not know what is to be redone in the third phase. But caring is one thing that we have thought, and it is not about blue collars or white collars, it is for all collars. So every single person was taken care of by every employee. The community was taken care. It was a complete resilience that we could see in the entire surroundings, that we could see wherever we were there or anybody was there. That was one thing that we can come out, and which made us proud that we can come out of any situation, even if it was this bad. Yes, learnings are there, and the panelists were excellent in some of the ways. Learned something from Abbott and the other team, that yes, there is a lot of things that we can do differently in terms of how we have managed COVID till now, and we can do it much better next time or the next phase in case comes. But luckily, as heard, vaccination is one thing that we thought that we should be focusing very greatly, and we pushed it to the wall to ensure that everybody, even a contract labor or even anybody who enters the plant, should be vaccinated. And in a couple of months, till the time we are completely confident, we will say, just like you say, Arogya Setu, vaccinated people only to enter into Mahindra. So if we can do that, it is going to be one big thing that is going to happen. So that's the way we are moving ahead. And I don't think there's anything more to add. So thank you very much.
Thank you, Vijay, for your views. I think we all echo the fact that, there has been a lot of learnings and humility, and like you said, a combination of vaccination and testing is the way forward. Thanks once again. Sangeeta, again, from your perspective on the IT side, do you also see this kind of rapid decentralized testing being a very useful linchpin in just ensuring that, you have the information to sort of ensure that your workforce is actually safe? And does that give a lot more peace of mind, or a lot more assurance in scaling up your back to work program?
I think I totally agree with what Mr. Siddiqui said, that vaccination is, I think, the #1 priority for the industry. So making sure our employees get as much vaccination available as possible. So that is the #1 priority. But I think the solution that Vinay has presented is very, very interesting. The ability to do this with the right safety precautions and the services. I mean, there are home kits coming out, but we would doubt the efficacy of some of that. But the ability to do this testing on demand in your workplace, I think is a good addendum to the vaccination strategy, where even if 20% of employees are coming back to work, and we can build that effective combination of saying, okay, you need to have been vaccinated, but we are also putting an additional testing layer in place. It provides a great amount of comfort and I think peace of mind for both the employees, their families, as well as the organization, because you are going to test or track asymptomatic cases much ahead of time. I think symptomatic cases are very easy. Every company has said, even if you have a cough and cold, stay at home, right? But I think it's the asymptomatic cases that we all worry about. And I think the solution presented, and I'm hoping there will be more innovation around where we can see many such more solutions coming up. It is a very useful additional strategy for companies as they return to the workplace. So I think definitely, as ASSOCHAM, we are already talking to Genpact as a part of the Rapid Action Task Force that they are part of. And we'd love to see how we can take this forward more within our industry. I think the second part of what more can we do collectively together, I think there's tons that we've all learned from each other in these last 14, 15 months. I think from an IT industry perspective, the whole hybrid work strategy and building new frameworks, processes, cybersecurity tools to be able to address that. And I think we'll be very open to see if any other industry wants to learn from some of our learnings, as we'd love to learn from what they have put in place to to address the next 12, 14 months, given the uncertainty that lies there.
Sure. Thanks. And completely resonate with your thoughts on best practice sharing and learnings across industries. I think that would be important, because I really felt that different industries may be on different curves as far as adapting to this environment is concerned. Companies in the manufacturing sector have really gone through a lot more. They have practiced and seen the processes, and some of them have worked, and they've learned more than the others. So I think that would be very useful. So to you, Anubhav, again, the same question on how do you respond to these kind of testing technologies, and do you really see them being very impactful, and how they can drive your back to work kind of process? And secondly, any thoughts on sharing learnings across industries? Hello.
Who's that for, Abhinandan?
Yeah, sorry, I think I missed Dr. Gaur. Yeah, just to be in the right order, I think this question is for Dr. Gaur.
Okay.
Sorry, Anubhav, I'm just coming to you after this. So, Dr. Gaur, again, from the testing industry side, how do you react to the testing solutions that are there? I mean, could this kind of technologies be very important for industry as we go forward? And secondly, your thoughts on the second part, which is about how should industry be sharing practices? Can something more be done on that front?
Yeah, I think we had an important discussion. I think all of us, the industry perspective from the diagnostics, as the Abbott has put up across. I think even as I can see that even vaccines are being rolled out as the first solution. But I think testing going to play a very, very important role. I think that is not going to go away. And that testing, we have to put our acts together and make sure that we have a rapid testing at worksite programs, whether it's RT-PCR, which is like ID now, something like we have a on-spot 5 minutes testing or 13 minutes testing. But the important part is like we need to have a right combination of various testing, because that is where the challenge is. Because you have a rapid, how do you make the program together? Because firstly, the availability of testing, the employees knows, okay, this is the testing which is available to my work site, I am comfortable, and test will come in right time and right kind of a thing. That assurance itself plays a very important role. The screening part, how do you make a program? How do you do a rapid antigen test? Then you followed by RT-PCR test, and what next to be done? I think that's also be clearly defined in the system. And the connection between the diagnostic and the providers and the industry, it has to be so well defined that every employee knows about this is what is really required. And lastly, I think one important talked about rapid antigen and home testing. I have little apprehension on those part, because that is something which is very important, but it should be done in a controlled manner. Because every test which is like, you can have a neighborhood booths, you can have a neighborhood defined chemists, you can have like Spice Health got routine, many of these contain labs, which is station in the containers and all across mobile labs for testing. But the information, because testing positive information has to be captured and shared. Because home testing, the fear is probably people will not be able to share. So we need probably have some kind of control, and whether it's the industry is doing or the factories are doing or whosoever is doing, it's an important tool. But they make sure that all information is captured very well and uploaded. And then the last important also is in like new technology adoption. One is that like you have self-sample collection kit. Can saliva be used? Now that's something which is important coming up. Now there are technologies when breath analyzes like alcohol. Breathonics is something which is now coming out. You blow air and you get to know whether, and these are very, I think as we grow from the diagnostic industry point of view, from technology point of view, I think industry should keep learning from across the globe and adopt as much as possible. And that's where we expect the government to come with a faster force and a very important role. And allow all technologies to come now. Because otherwise there's some restriction on the pricing, capping and multiple things. I don't want to go into all that, but I think that makes some kind of a problem for the diagnostic providers and even people very apprehensive. I want to report in 2 minutes and 1 minute and 5 minutes, 10 minutes, but RT-PCR gives me 8 hours. What do I do? I think that's important part. And lastly, and most important, is from the healthcare point of view, I'll say, is the validated information. All industry, all people too, because today there's a WhatsApp university going on. Everybody reads and they get confused at the end. So I think every industry should have a validated platform to answer all apprehensions and queries and questions. I think if that is put into place, a lot of anxiety and everything will be allayed, and that will take care of most of the things. Let's not forget, because there are many people in the industry will say, oh, this virus is going to catch me. No, anybody, any age group can get it. But it's not like we are like discouraging people to come from work. So remember, the threat is the virus, not the people. So if we can keep that virus under check, we keep the virus testing properly at the right time, screening, and I think we can take care of most of the things. And that's the way forward, I think. Thank you so much.
Thank you, Dr. Gaur. That was very comprehensive and insightful. I think you did touch upon new technologies. You touched upon some apprehensions that are there with the current technologies, and of course, those need to be addressed before they can be scaled up. Because now it seems very clear that as companies roll this out, they will play the role of a lot of the testing. So employees will really depend on reliable support from their organizations, and the technology needs to be able to support that. So moving on to Anubhav again, with the same set of questions, if would like to hear your thoughts.
Yeah, so Abhimanyu, I think as all panelists, vaccination remains the first layer of security that we want to, obviously, from an employee perspective, we want to cover that, and the rapid antigen test could be a potential, another layer that helps prevent the virus. I think one thing which will be important from an industry perspective will be recognition of rapid antigen test by authorities, and specifically more from an India perspective. While CDC has approved certain specific, self-testing kits, but that's under the supervision of a medicine consultant. I'm not sure if we are still there in terms of getting some of those approvals and ensuring that someone with that test can really travel freely. So that's more from an industry perspective. The kind of sharing that we can do, definitely there is, as I told, there is a huge workforce which is working constantly with within Boeing, with universities, with medical professionals in terms of research which is happening, and a lot of that material is really publicly available on our Confident Travel website, where we are sharing with industry norms, what some of the simulations, what are some of the test results which are coming out, and obviously, not that we can replace from what a medical body would be given, but we are definitely supporting and working from a data oriented perspective with a lot of agencies. So that information is already available, and we'll be happy to share with whoever wants to understand and deep dive in some of those areas.
Thank you, Anubhav. Thanks for your comments. Now over to Urvashi. I think while you raised that point around testing in your opening remarks, if there are any other thoughts you have on these 2 points, and also on the solution that has been proposed.
Look, I think as an organization, we stay very, very committed and very clear in our perspective that testing is going to be extremely important. But again, like I said earlier, testing alone is not the only solution. It has to be a combination of vaccination, workplace related safety protocols, COVID, relevant behavior, as well as testing. We will continue to work with NASSCOM on the entire Rapid Action Consortium, and that's where we think we will be able to bring scale to this entire testing and the entire monitoring protocols across the industry. So that's something we are looking forward to quite significantly. I would like to touch upon, I think, the point that Vinay made earlier, which was really the psychological benefits of testing, I think, for employees. And given that we've done it for the last several months, and rightly so, it started with very, very few people doing it voluntarily. We, as an organization, our job was to provide that facility to employees. But as people took to it, I think they saw the benefits. So it's a slow shift. And it helped us, I think, over the last 6 months to now make it mandatory, and we actually face no opposition from our employees at all, because they've gotten used to it and they've seen the tangible benefits. So I think it's very relevant, to mitigate an outbreak at the workplace. And our numbers show that our population that was working out of office and that got tested, hardly anyone was, even if they were positive, it didn't really spread to other employees. which I think was very important. And that was fantastic for employee morale, for the basic confidence that people had and their families had that they're going to a safe workplace and that there was no further danger of transmission there, or at least it was a reduced danger of transmission. So I think as an industry, we have to, the space is going to continue to evolve. I don't think any of us know all the answers right now. We might be talking very differently maybe in a few months. We are looking forward to, I think, advancement in technology and to the regulators for greater access to vaccines, for more testing methodologies, to the nasal vaccine that Siddiqui Sahab spoke about, because I think that's going to be a big game changer in the larger scheme of things. So we continue to watch the space very, very carefully and continue to do whatever are the dominant trends towards prevention of COVID and keeping our workforce safe.
Thanks. Thank you. Thanks for your comments. So now I think we have overshot a bit, but I'd just like to, before I just give one or two closing remarks, I think Vinay can maybe come in quickly. And having heard all of the speakers, I sense that most industries are keen on using these kind of rapid decentralized testing along with vaccination, along with a host of other things that they have in mind. They may have some apprehensions around the reliability, etc., but I don't know how fair those are, and maybe things will evolve. Technology is also evolving rapidly. So to me, it seems that rapid testing is going to be important in this game going forward.
Thanks for that, and thanks to all the panelists. There are two key takeaways that I'm taking from here. One is technology. There's an inexorable improvement in technologies, and we always have to be looking out for the next big thing. It's just human nature, and we will continue to work on that. And initially there were some tests which were, the sensitivities were very low, just over 50%. Now they're talking about as close to 90, 98, 99%. So you get much more confidence, as well as other technologies coming up in place. So that is one. I'd like to end with a little bit of a heartwarming story. And there's a factory where we are doing this testing. It's a manufacturing company. There are 8,000 employees in that factory. 4 months ago, there was an asymptomatic case. Person came, infected the department. Nothing happened to him. His colleague passed away. The factory was shut down for 15 days. Disinfectation, all that stuff happened for the factory to open. That factory supplies cars to 46 countries. This story, by the way, is not from India. So don't just jump to conclusion on which company I'm talking about. But we have set up a testing mechanism there now that every week now everyone is getting tested. Now, where it becomes very important is during the course of the shutdown, of course, all the employees and everyone was getting paid by the company. There is a parallel economy running outside these factories. The panwala, the juice shop, the tuk-tuk guy who brings people there. 200 families depended on those 8,000 plus people coming every day to that factory. And for 15 days, they were hand to mouth. That's what happens when these kind of, we don't even think, the next level impact that these things cause. And now, I take great pride and satisfaction that, we are not only supporting businesses run in a very resilient way, but the informal economy that is so strong around these companies, we are providing huge amount of sustenance to them. So I congratulate all the panelists who've already implemented these solutions to make sure that not only does your business stay resilient, but you are providing them greater good around your organizations. So thank you very much.
Right. Thank you, Vinay, for that very interesting story and the fact that your organization is making this kind of an impact across client sites. So I think just to summarize, we've had a very interesting sharing of thoughts, and Some of the things that are sticking with me is the pandemic is not going away in a hurry. I mean, there will be different. It will evolve. It will change in its form, but it will probably come back in different forms. So, I mean, we are all being taught to make ourselves more resilient, make ourselves prepare ourselves for any future outbreaks and setbacks. So, in the context of that, now as companies are going back to work, it's the business leadership which will have to take a very important role. I mean, till now we've been, praising or blaming the government. We've been blaming our civic authorities for various things. Now, companies are going to be driving change. They will have to deploy the latest technologies. They have to put in place robust systems and processes. They have to learn from each other. And whatever technologies or latest state-of-the-art methods are available throughout the world should be deployed, be it rapid testing or be it vaccination, be it any other forms of risk mitigation. So it's great that I mean, it's very heartening, like when I said that all of these different industries are already on their way to setting up these systems, and hopefully we will come out of all of this stronger and more robust. Thank you. Thank you. Thank you very much.
Thank you, everyone.
Okay, thanks. Thanks everyone. And
Thank
sorry for the going extending by about 10 or 15 minutes. Sorry about that.
Thank you, everyone. Stay safe.
Thank you. Thank you.
Thank you.
Thank you.
Stay safe.
Thank you. Bye.
Thank you.
Thank you. Bye.